And the third thing, I love blood. So the very sight I would inject something, or the thought of
like
knowing and having that up with your committee.
You need to have a lot of patience.
Yeah, it
with BDS posting.
Hands down, it has to be oral and maxillofacial radiology. Not surgery. I would purposely said oral and maxillofacial because I knew you would expect me saying surgery. But I said for the simple reason, the dark room. क्या खाओगे? Directly बिरयानी खाओगे? मतलब थोड़ा कुछ starter वाटर लो, कुछ करो. I just hope that I don't get
in trouble.
Call from the
departments.
Any authorities from the college after they get to know what we. No, we are all Bollywood buffs. Shah Rukh Khan has been telling us since ages. We like how does this guy even land up on the podcast in the first place?
And talking about clinical dentistry.
Exactly, and there's. I think more than anybody, I would like the staff. I won't take names, but there are staff who are going to be like shocked. They're going to like literally jump off the seats. ये बंदा क्या बात कर रहा है dentistry के बारे में?
Hi guys, welcome back to the channel. In today's 19th episode of the MADtherapy Sessions podcast, we have Dr. Devang Bidaye. Dr. Devang is the head dentist and the owner of Ace Dental Care and Epident Implant Center. He's also the proprietor of Devapex Venture, an HR consulting firm in Mumbai. So Dr. Devang, you have worked in the Jumbo Center in Mulund extensively during the pandemic in the last, say, like 2 years. How was the experience and what was a dentist doing there?
So if you ask me the experience-wise, I mean, it was a very, I'll say, fulfilling experience. Mm-hmm. And the reason for that is because I got to see a lot of stuff firsthand.
Okay.
Which I think as dentists, we don't get enough opportunities to see. Mm-hmm. And at the same time, I got to learn a lot of stuff, which I'm not saying is not taught to us, mm-hmm. but it's not kept in focus in our syllabus or in our, the curriculum. So like a lot of emergency drugs, a lot of, the bedside or the chairside procedures. Some ones like administrating IV drugs, administrating IM drugs, then drawing blood just for blood tests and hemo profiles, then doing the general examination. So on the chairs, I'm not saying we don't do it on chair side, but it is not a mandate. As you know, because in the dental setup, clinical setups, usually when we look at the patient and when we have the first interaction with the patient, we usually kind of get a gist like, okay, the patient is stable, he's oriented in time, place, person. So you need not go through all of that protocol. But when you're working in a DCHC, when it's a pandemic situation, so that is a time when you cannot omit any single step. So even a person who's like absolutely looking fit, fine, he has a bulk body, everything. Or if it's a frail person, but he's still walking perfectly fine. But you have to go through the entire protocol.
Okay, understood.
The general examination and all has to be done. You cannot just skip steps.
So how did you decide to voluntarily join one?
So the very first thing, we are doctors. I mean, we should not forget that we aren't just dentists, we are doctors. And it's high time we start behaving in a way that people refer to us as doctors in the first place. And people start getting it in their minds that, okay, ये dentist है. No. ये डेंटिस्ट है, ये डॉक्टर है, बट ये दांत का स्पेशलिस्ट है, क्योंकि इसने पढ़ाई जो भी करी है वो एक अपने मुंह के आसपास जितने भी एरियाज है उससे रिलेटेड पढ़ाई करी है. तो ही और शी इज अ स्पेशलिस्ट विद रिस्पेक्ट टू द हेड, नेक एंड फेस रीजन. But that does not mean we are not doctors. Okay, so first of all, we are doctors and we should do everything in our capacity to help a patient or to help an individual reduce his or her pain. That's one thing. Second thing, why I wanted to do it, because I was always in I was very interested in the general surgery and the general medicine batch of the vertical of our studies. And I always wanted a chance to be associated with some hospital or somewhere. I used to keep on searching, is there any camp happening? Where I can go as a dentist, but I can help them in their work. So I can get to learn that. And the third thing, I love blood. So the very sight I would inject something, or the thought of knowing. The thought of having that scalpel in your hand and just giving incisions and suturing and all that, that was like, I personally love it. So I was like, no better opportunity. It's like a little bit of selfish gain, but on the whole, I have to do my service as well.
So I mean, how was the total experience? Because you were not there for like a few days or few weeks or few months. You were there for
for
a couple of waves.
So over a year almost.
How was the overall experience? I mean,
so the good things all apart, there was also, I'll be very honest, brutally honest, because I want everybody to know. I have seen deaths as well. And my first experience with when I had my first death, and I was the signing officer for that. So it's a procedure when you are in charge of a hospital or anywhere, and when I was a RMO there. When under your supervision there's a death happened, so there's a form. It's called as a death. That form is there. We have to sign it and you send it to the BMC, the local authorities. And after that they issue the death certificate. Now that certificate will be issued only when you have given a sign and whatever you have written, the cause of death. Based on that, the death certificate is made. Now, the first instance when I had to write that letter for issuing a death certificate, honestly, I had I was literally blank. I couldn't understand what to do. I was just we've written love letters, we've written hate letters, we've written n number of shit. We've left exam papers blank maybe, but this is something which it was it was like a numbing situation. So I was a little bit, I can say, scared as well, but it also kind of it taught me a lot. And after that is the day. After that day, I don't think I have looked back. And I think every patient, even on my dental chair, which I have done, I guess that one incident has made me at least that 30 to 40% more empathize, and more than empathy, I think I have become a little more serious with my work as well. It's not like I wasn't serious before, but now even if I know something, I'll just kind of go back, I'll refer again, I'll be even if I'm 100% sure, I'll try to put that 110%. And I'll do that again. So that was one thing, overall, if you ask me the experience, it was great. I learned a lot of stuff, everything, enjoyed as well. I had one of the best colleagues over there as well. But this experience, it's
one of a kind, man.
Yeah.
That kind of something which you get to experience.
Yeah. That was very, it's a rare thing. And I feel honestly, every doctor, irrespective of which vertical he or she has done his graduation in, it can be dentistry, it can be physiotherapy, it can be Ayurveda, it can be homeopath, anything. Everybody, in my personal opinion, should work with a hospital, should work with the casualty, and should experience because there are times, it's not every time you'll be able to save a patient. There is going to be a day, if not today, tomorrow, whenever, in your entire career as a practitioner, as a medical practitioner, there is going to be a time when there'll be one patient where you can put the best of your knowledge, you have given to the best of your ability, but you can't do anything. That patient is going to slip. And you have to take it in your stride. I mean, it's only that if you can take that in your stride, it's only that then you can, next time you will give more. If you're giving 100%, you'll give 110%. So I think that experience itself, I don't know how to put in 2-3 words, but if you ask me, in short, a learning experience, fun as well, but on the whole, it was more of a responsible thing. It kind of gave me that added sense of responsibility. So I would say it was a very responsibility understanding, or a maturing experience. I would say a maturing experience. Yeah.
Good enough. So you were also the scientific head in your internship days in your
good old days
dental school. Did that help? How was that experience?
Oh, that again, now I have to again be extremely thankful to our college, D.Y. Patil School of Dentistry, and the entire management. And also, not to forget Dr.
It's a prestigious position.
Yeah. And also Dr. Akshita Prabhu, who was our scientific convener at that time. And also Dr. Vijay D. Patil, because he had given us the opportunity and I could, after getting through the elections, as you know, it was a student decision. So I was really happy to have that opportunity. And what that essentially helped me was, because when we pass out from dentistry, there are these few names which you just keep on randomly hearing from our seniors or outside somewhere. Okay, this doctor is doing this, that doctor is doing that. But integrity, and scientific committee on the whole, that gave me the opportunity to come in contact one-on-one with those who's who of that particular vertical of dentistry. Apart from that, in the college itself, it gave me that opportunity to learn how to manage an entire event. And more than that, also how to lead your entire committee into working with it. Because having the dialogue with the speaker is one thing. Having a dialogue with your own batchmates, your juniors, your seniors is another thing. And having a dialogue with your committee.
You need to have a lot of patience.
Yeah. It teaches you, it gives you those nerves of steel,
Yeah.
It's like you're going to be slapped, you're going to be hit, you're going to be shaken from inside, but you got to just keep your calm. You got to say, it's okay, I will handle it. This can be handled. It's okay. Just, you have to keep your cool. But Yeah, the one thing, like it's the best thing which has happened is it teaches you how to keep your calm. It teaches you to apply. All of us, everybody has their own intellect.
Yeah.
They have their own abilities and they have their own presence of mind. It is just these certain situations which put that to test, and that is when you as an individual realize, okay, I'm capable of doing this. Maybe before that situation wasn't there in your life.
Yeah.
But once you're put through a situation, you exactly know what is the you know, okay, I'm capable of doing this. I can do this. So the self-awareness, I think. So if you ask me, the best thing which happened, it was the self-awareness that I could lead my batchmates.
Yeah.
Because then come on, there are going to be times you will not agree with them. There are going to be disagreements. You will think that, okay, I should do this. They'll say, don't do that. So, but you got to learn how to put your foot down and say, okay, I want to do this. I will do this.
Yeah.
If anything goes down south, I will take full responsibility. You just do it for now. If it goes down south, next time, whatever you say, we will be doing that. But this time, I have made a decision, and as a head and as your committee person, I would like this thing to go or to advance in this manner. And eventually, if it works out, they will understand that, okay, you weren't just talking from the air. You have something in your mind. You've thought about it. There's a backup plan. And then you've asked to do that. Even if it bombs, they are still happy because they know that now ab agli baar se hamari sunenge. So it's a win-win situation. So that it basically makes you aware of a lot of things. So self-awareness is something I feel to every budding dentist over there, if you didn't get a chance in your college days or whatever, even if you're out, you're into private practice or you're into PG or into any course, if there is an opportunity wherein you get to work with a group of people where you're supposed to take some decisions and where you're supposed to give your opinion for that matter, I would say please take it up. Do it, because it will help you not just for your own self, it will help you understand interpersonal communications and it will help you to understand how to maintain the interpersonal relations as well.
Understood.
Yeah.
So, sticking to college, what was your favorite BDS posting?
Hands down, it has to be oral and maxillofacial radiology. Not surgery. I purposely said oral and maxillofacial because I knew you would expect me saying surgery. But I said oral and because it's OMR, oral and maxillofacial radiology. That has been my favorite for the simple reason, the dark room. I have. Okay, just coming back. Not just the dark room, the entire department, not just the dark room. Please don't get me. But yeah, the reason I say OMR is because every patient had to walk in that department. Okay, and in that department, after we did their oral examination, we kind of devised a treatment plan. We kind of guided that patient that if first you have to go to this department, then you go to this department, then you go here. And we explained to the patient what you have told me your chief complaint. You've told me what all is wrong with you. You have to actually explain the patient to the best of your abilities with your examination and diagnosis that what you feel is wrong with that person, what you feel has to be done. And when you take his or her radiographs, you have to study them and then you kind of know, okay, like this is wrong. You have to explain it to the patient that, you know what, this is how it is looking. This is normal. This is not normal. So point being, you basically get to decide the entire treatment protocol. You get to tell the patient, you get to not just guide the patient that these are the things you're supposed to do. So I this is what I feel, nobody can directly go to the surgery department or to the periodontics department or to the, histology department because they're going to be like, where is your paper? Where's your examination chart? Everybody has to, it's like, just when you enter a restaurant, you can't just say, I want a chicken biryani. Bro, like, क्या खाओगे? Directly बिरयानी खाओगे? मतलब थोड़ा कुछ स्टार्टर वाटर लो, कुछ करो. या फिर क्योंकि अच्छा I want a brownie बस. मतलब ब्राउनी खाना नहीं है. तुम पहला कोई स्टार्टर खा लो, मेन कोर्स खा लो. चलो तुमको कुछ भी नहीं खाना तो फिर तुम रेस्टोरेंट में क्यों गए? Like just go to a dessert parlor. So it's just like that. There has to be an order, and that is set by that department. And I'm not saying that nobody else can do it, but oral medicine and radiology primarily deals with the diagnosis and treatment planning. And that is something which I love, so that is hands down my favorite. And I have, like, through the entire college, wherever patients have gone, okay, like, they have always said कि हमको वहाँ से बोला है पहले यहाँ आना. So all of them were like कि नहीं पहले. And even when they came, okay, whenever they went out, they told others कि ना वो जाओगे ना बिल्डिंग में, ग्राउंड फ्लोर पे जाओगे ना, वहाँ पर चेक करेंगे, वहाँ पे तुमको बताएंगे कि कहाँ जाएगा, तो पहले सबसे पहले ना वहीं पे जाना, वहीं पे जाओ
बराबर.
I was like, okay, so this is nice. Yeah. That's what I enjoyed it. Also, like, guilty pleasure, class 2 वहीं से चुराए थे.
Yeah, lucky man, you got class 2 inside college itself. हम लोग तो कहाँ गए थे यार.
So, yeah.
Any special, like, I don't know, funny or any special dental memories you have of college which you would like to share? Anyone?
Oh, there are many. I just hope that I don't get
In trouble?
call from the
Departments?
any authorities from the college after they get to know what we've done. But yeah, you might. This is one thing I can share on the podcast. Yeah. I'm sure you all might. You might have gone over there, but there was this area on a terrace where the board is there. Okay.
Yeah.
Very clear.
We did a photo shoot there.
See, they're legends. That's how we've come to know. See, and Dr. Arib, please, for everybody who's listening and seeing, Dr. Arib is my senior. Not just my senior, he's been a guidance. And let me. I didn't know about that place. These guys have gone there. That's how we didn't discover. They discovered it. We just followed the trend.
Don't blame us.
I'm not blaming. I'm just telling that, okay, like that was the path and we've just tread that.
Because we went there and it was like, going to a hidden area.
Yeah, it was a gem.
Ye kab aaya? Like, so please continue.
This was again, we were in the middle of the committee meetings and all that, scientific integrity meetings. And after the fest was supposed to happen. So I was with the cultural committee and all that people. And they were like, यार बोर हो गया यार, क्या करते हैं यार, पूरा दिन काम कर लिया है, दिमाग नहीं चल रहा है, आइडिया ढूंढो ये वो. I said, let's just peace out. So we went to that place and some very good denatured spirit liquids we took along with us, and that was a beautiful evening. I think we spent almost around 3.5 hours. It was beautiful. It was just beautiful because the view from there is amazing.
And at that time you could see the entire Nehru.
Yeah, because that was just before the new installation came up. So exactly. That board was very accessible.
Yeah, you could see everything. Yeah,
it was nice. And also another one memory was, now I think they've renovated it, but we had this not so very interesting discussion. It was kind of a heated argument, or I don't know how to term it, whatever it was, but not in a very good thing. But so we wanted to keep it just between us, and we didn't want the other students or to come out to the public. So that time it was a locker room, and just in that corner, okay, I don't know if you know this, but the windows used to open up outside.
Yeah.
So we had put a ladder there.
Towards law college and
so just to get out from the other side so that nobody notices that we've come in here, we went out from there after that.
Oh shit.
So yeah, those are just...
And we were thin enough to come out of
Exactly. And at that time, like that fear wasn't there. Like we could still do all of that, think of all of this stuff to do. But yeah, then now slowly, now if you ask me, oh no, I don't go out of windows, please. I use doors.
So Dr. Devang has done his fair share of his fun in
I'd say more than fair.
Yeah, I'm keeping it fair. So after passing out from college, you did not do masters. You stayed as a general dentist. You, of course, you did a few programs.
Yes.
Which we'll talk about it. But why general dentistry? Why did you stick to general dentistry?
Again, like I just said to your previous question, I had answered oral medicine and radiology. So the love for that diagnosis and treatment planning. Okay, I'm not saying that specialists or after doing your PG you can't do that.
Yeah.
But when you're practicing general dentistry and when you are examining a patient and when you're making a treatment plan for that patient, it is like you kind of guide the entire treatment. You kind of head the entire treatment. Let's say, for example, I have a patient who's come in with, say, he has certain carious teeth and he or she wants to get the entire smile done. He or she is not happy with her smile as well. She says, Doc, my teeth are looking a little random. They're black in some places, they're brown in some places. And when I smile, I don't like my smile. So can you do something for it? So if, when I'm examining that patient, I will of course make my impressions. I will make the study casts, I'll check the working models, I'll take her radiographs, and after that, it's going to be me who's going to first assess and give an opinion as to if she first requires any orthodontic intervention, wherein if the teeth are really beyond the scope of prosthodontics, that I would require her to orthodontically move her or his teeth, and then to get prosthodontics into it for putting the prosthesis.
Yeah.
So I would be the in charge for that. After that, if she, let's say she requires ortho or she doesn't require ortho, that one thing is finished. After that, coming to the perio part of it, the gums, the pink part of it, whether she really requires any flaps, whether she requires any grafts, whether she requires any kind of changes with the soft tissues. Do I need to get the perio on it or not? Then coming on to the next aspect about endo and the surgery, whether she requires endo and I can save those teeth, or I feel that no, I need to get those extracted and I need to put implants over there. So all of this, I will make those treatment plans. There'll be plan A, plan B, plan C, which I think should be the best for the patient.
Yeah.
I'll explain to the patient. Once the patient consents his or her choice, and he or she gives their consent to the treatment plan, then I take it up with my consultants, who are MDs in their respective topics and fields. And then I tell them that, sir or ma'am, this is the treatment plan I have devised for this patient, and the same he or she has consented for.
Yeah.
Now I am giving you her working models, I'm giving you her radiographs. So can you tell me, can we pursue this plan? Then of course, if they say, oh no doc, you know what, I don't think this case requires ortho, I think you should directly go on to the prosto part. I'll say, okay, thanks. And I'll come to the prosto part.
Yeah.
If they say, oh no doc, you haven't mentioned ortho, but I think this does require an ortho treatment.
Yeah.
I'll say, okay, cool, I will consider it and I'll do that. But throughout this time, it's me who's kind of guiding
the deciding factor.
Yeah. And also another thing I have to add, because the patient first has come to me, whoever comes and does the work, the patient is going to say, okay, I went to Dr. Devang and he kind of called this doctor, that doctor, whatever. When the patient goes back, when he or she is hoping that he or she is happy, considering he or she is happy. So when they go back, I'm not saying they won't say which doctor came and did it, but the first thing they'll say, go to Dr. Devang's clinic, because he has really good consultants coming over and he gets the correct treatment done, or he gets the most patient friendly treatment done.
Yeah.
And I think that is what I like to keep the focus of my work. But I think I should keep it more patient centric rather than only the operator centric. And wherever then I feel that, okay, now this is an area where I have to step in and put my foot down that yes, this has to be done this way only, then I can do that. Again, I am not trying to discourage or disrespect any MDS faculty or specialty. All of them are, if given a chance, I would really study. It's not like I don't like it.
No, in fact, they would also love someone who's into so much into general dentistry and guiding the patient so well, and it makes their job easier.
Exactly. So that's what. Yeah, this was one feedback I got from a customer, because he was he had just told me I'd been to 2-3 clinics, but then he was like, I didn't know how to tell the patient in front of the doctor because he or she had not advised that thing. So at times it doesn't look good also in front of the patient. So it's better if you have these conversations in your downtime with your consultant, or before the patient has come in, you sit with your consultant, discuss the entire treatment with them, and make sure that the two of you are on the same page, and then take it in front of the patient. So yeah, general dentistry is a good thing. It's a great thing. But if anybody wants to study and immediately pursue their post-graduation, please do. There is no discouragement for it. But you should at the same time exactly know that if you're entering your post-graduation, this is what I feel, that first your basics should be really clear. Your foundation has to be really strong, because only then you'll be able to study further.
Understood.
Doing PG does not mean learning the basics. Doing PG or in any faculty, it means learning the advanced procedures of it. It means learning into depth of that subject. It means knowing the very fine details, which we will not know because we haven't studied that much. So when you're doing that, be really sure that your basics are genuinely strong. Else it's going to be like that tower, which was, it's a 20-story tower, but your foundation is not good and it's going to come down. So that's why.
Like for example, you worked as after passing out, as a dental graduate, you worked in a couple of places as a dental associate.
Yes.
And then you worked in a clinic, and then eventually you took over that clinic.
Yes.
So can you share something more about it?
So yeah, again, after college, so I think I had that thing in my mind very clear that, I always wanted to, I won't say I want to stop at doing BDS. Of course, if the conditions are favorable and everything works out, I will definitely eventually try pursuing my MDS in oral medicine and radiology. After I was very clear after my BDS that I want to go in the clinic and start working, because the first thing was like, I honestly, like, being me, I have not, all of my batchmates know that I have not worked enough in college. Like, I didn't, because like there were many reasons to it, but I couldn't kind of give that enough time for my clinical work, and I couldn't learn my basics properly. And that's also because I was lazy enough to not study properly. It was only when I started working outside, I understood, oh my God, there's so much more to it. And that kind of drew me in, because when I did my first composite class 2 cavity, and when that patient went back, and the patient was so happy, and I was like, wow. That same, like, slowly after that, patient after patient, when initially I didn't do a very great class 2, it was probably the contact point was not that great. So the patient again came back saying, Doctor, wahan pe thoda khana fas raha hai. I said, no problem. I repeated the class 2. So of course it took time. But one thing I was absolutely clear was that I want to do clinical dentistry. I want to practice dentistry. So I want to learn my basics, because I know, and this is like, guys, I think I would like to tell this to everybody. Like, you know your knowledge, your skills, and your capabilities the best.
You can't lie to yourself.
Exactly. So you have to own it up. You have to, like, take it in your stride and start working towards it. And just like, no, we are all Bollywood buffs. Shah Rukh Khan has been telling us since ages, किसी चीज को शिद्दत से चाहो तो कायनात तुमको उससे मिलाने में लग जाती है. I am a bloody prime example of it. I have had grace marks as well in my exams, but today it is the same me who's talking about all this. And if I'm saying, if I can do this, bro, every damn person can do it.
And some people who are listening to you, who will listen to you, will be shocked to know that.
Exactly. They're going to be like, how does this guy even land up on the podcast in the first place?
And talking about clinical dentistry.
Exactly. And there's, I think more than anybody, I would, like, the staff, I won't take names, but there are staff who are going to be like shocked. They're going to like literally jump off the seats. ये बंदा क्या बात कर रहा है dentistry के बारे में? So, but literally, my point is that I was really clear about what I wanted to do. I understood what were my shortcomings. I understood how much I had to put my work in. I was ready to give all of that work, which is why I first started working as an associate. When I finished working, the first place I started working at, when I got to learn whatever basics I wanted to learn over there, then I thought of advancing a little further. Then I came to this clinic and I started working under Dr. Akshay Chaudhary. And I think he's one of those best guys over there, because the way he has taught me, I think a lot of things I have learned is from him. So the way, I think after working with him, a lot of things of my own personal practice have changed. So I think I absolutely, like, I'm really happy that, I have these 2-3 places where I have worked, like, because they not just gave me the experience, but they gave me what I wanted to learn.
The confidence.
The confidence.
Sometimes you just need a pat on your back. Like,
and that support. I mean, touch wood. Like, I'm not saying it's not difficult, but you have to, if you want to get into something, you have to first be clear in your mind that you want this. I'm not saying that things will, just pop up randomly one day, but if you have that dedication, if you just put in that little bit of effort, that even if and a lot of people have, I forgot, but this is some good person, I've read it somewhere. They say that hard work always beats talent. So it does not matter if you're, like, however talented, by birth you might be a great person, but if someone else is putting in just the hard work, I'm not saying there's going to be a comparison, there's going to be a competition, but that person will get wherever he or she wants to get, for the simple reason that he or she has accepted that they are not that talented, but they are ready to put in that extra amount of hard work. So which is why then, like, you have to do that. And the reason, again, like, I was working at that clinic as an associate and I took over that clinic because this is not bragging or nothing of that sort, but honestly, like, I think the reason why he could hand over his clinic to me, because I think somewhere he had that confidence that, okay, maybe he might not go that high, but he'll definitely not take it down from here. He'll maintain it or either take it up. And it's something that you have to instill that kind of confidence within your peers. Only then you can, go ahead. Nobody is like a 10 on 10. Everybody is somewhere, trying to work up their way. But the moment someone sees that, okay, you are hungry for something, you are dedicated for something, you have that goal fixed in your mind, they will help you. No matter what your shortcomings are, they will cover it for you at times because they know that you have the potential. So it's just about, like, that's why I always say, like, self-awareness. Like, I think I've mentioned this earlier as well. Guys, we as dentists, we have to get up, because we are genuinely, the 5 years of BDS, we learn so much of things. We learn carving, we learn restoration, so much we learn. Like, there are so many artistic things. Our fingers start working in a different manner. We can handle stuff much better than a lot of other people. And I don't mean to demean anybody, but we are working with a part in our body which is in millimeters. So can you imagine the amount of perfection and finesse it requires, and the margin of error which is like so less.
The hand-eye coordination, like
Exactly.
where few teeth we're like treating indirectly without
exactly.
like
indirect vision. Yeah, we cannot see it directly. It's indirect. So
we are screwing up our backs.
Yeah, ergonomics is another big issue.
So like what would your advice be for fellow dentists out there who have just passed out, or forget passed out, may have been practicing but now thinking of putting their own practice?
Okay.
What would your ideal advice be for them?
Well, ideal though I can't say, but from my personal experience I would definitely say this, that if you want to if you've passed out, first of all sit with yourself and understand whether you immediately want to start practicing or you want to again pursue your post graduation.
Okay.
Once you've got that clear in your mind, then you start again ascertaining whether you're going to immediately put up your own clinic. If you have that confidence, if you know that your foundation is strong, your base is solid, and you can handle the day-to-day situations, then you can immediately start off with your own clinic. There is nothing like it. But if you feel that no, I think I need to get that bit of experience, I need to learn some things, there are some foundations, some basics which are kind of lacking, then I would strongly advise you to join someone, observe someone first.
Okay.
Again, let me be very clear. I'm not saying be an associate. I'm saying observe.
Okay.
First, go and observe. Look how the clinic functions, because I think this is something which someone would have told me. I could have really used it. So before even starting to work as a dentist or as an associate dentist anywhere, first up, go to any clinic of your choice. Take permission and start just observing them. Don't do a single thing. Just help them on their background work and look, carefully observe how things are going around in the clinic. How is the patient management happening? How is the patient interaction happening? How is the treatment happening? How is the person following? What protocols has he or she set? Look at everything. See if that really interests you. See if that's something you want to do. Only if you feel that, yes, you know what, this is something I want to do. This is something I like. Then become an associate and start actually doing chairside work.
Understood. Yeah.
Take it stepwise. Don't jump into it just because you have the opportunity. Wait. Take it slow, because time is there. Still now I get this thing, bro, you're aging. What is this? Your time's not going to go back. When are you going to take the next step? Please don't listen to such people.
Yeah.
People are going to keep on telling you कि अबे कब करोगे, clinic कब डालोगे, ये कब करोगे, वो कब करोगे. It's no. Don't listen to this crap. Please follow your own thing. Everybody has their own timeline.
Yeah.
You should take your own time. First, observe. See if it's the thing for you. Only and only if you find it interesting, and if you find that you won't get bored to do this day and day again, every day again, then you take that job as an associate. Once you worked as an associate and you have understood the kind of work it takes to sit on that operator's chair, then you think whether I can actually manage all of this on my own.
Yeah.
And then you think of starting your own clinic. Again, I don't mean to discourage anybody. If someone has the confidence and he or she has his or her basics absolutely strong, no problem. The day you graduate, next day start your clinic.
Yeah.
But if you have even 0.00001% of doubt, please take a step back and take your time. Do not go in with any other influence. Do not listen to anybody else.
Yeah.
Please listen to your own self. Listen to your own mind. Your heart will bloody give you the answer. If you observe in a clinic and you don't like it, I will be very happy if they use this thing, and if they feel that no, clinical dentistry is not my part, I'll be very happy. They can very well go to some other field.
Yeah.
Because it's not like dentistry is only about clinical. There's also the administration part of it. There are a lot of things.
Yeah.
But it's and now there is information widely available about it. So you need not think that dentistry only means opening up a clinic or getting attached to a hospital and just doing patient work. There is a lot more to dentistry.
Yeah.
It's only and only if you take the time to sit back, find those things out, and see what interests you the most. Then it's going to help you.
Yeah.
And then you'll definitely get where you want to get. Because then when you reach where you want to reach, and when you get the things you've thought of and you've planned for, you've aimed for, the people who were telling you yesterday कि ये क्या कर रहा है, ये क्यों कर रहा है, ये ऐसा नहीं होता, वैसा नहीं होता, all of them will bloody come and clap.
Yeah.
Even if they don't, behind your back also they're not going to say anything.
Yeah.
They're just going to be bloody happy because अरे यार इसने ये कर दिया.
कर
That's what that tone is going to be. Because in life you're going to get everybody who will put you down, but very few people will kind of be genuine enough to support you.
Understood.
So yeah.
I mean, those are great points. any particular thing which young dentists should take into consideration when they're buying dental instruments? I mean,
this is a big thing. Buying, again, now, as dentists, as medicos, if I put it in proper terms, I think we lack a certain amount of financial knowledge.
Okay.
And
I mean, what do you mean by that?
Yeah. So I would like every person who passes out after BDS, when you have that time, please read up a little bit about finances. Please read up a little bit about management of money.
Okay.
And please learn that, because we have always been, we've been focused on studying, and we've always been focused on one stream of things. But finance, economics, management of money, all of this is something, a totally different ball game. I don't feel shy to admit this, that I had no clue about this. It's only after I started my own clinic, I started understanding the management of money. I started understanding the concept of capital investment. I understood the concept of management of capital. So I think while you are setting up your clinic, or you're setting up any practice or anything for that matter, please understand the dynamics and the economics of it. For example, if I've bought an endomotor today, let's say it costed me, it doesn't, but let's say it costed me 10 rupees.
Yeah.
After 1 year, it's going to cost me only 8 rupees. So everything you buy, the moment it's off the shelf, the price of it starts depreciating.
Yeah.
The commerce people, they call it as depreciation.
Yeah.
Anything you buy can either be two things. It can be an asset, it can be a liability. Now, whatever you're buying, okay, if it's generating you money, if it's generating you income, it's going to be an asset.
Okay.
If it is taking money out of your pocket, if you have to only keep on investing, it's going to be a liability.
Yeah.
So, like, for example, when I say that I have a Rolex watch, it's some people would say it's an asset, some people it's a liability. So you have to understand how to use it. Those, if you go after 2 years or after 5 years, and if you sell it to a person who's totally into watches, he will give you a much more price. Then it becomes an asset.
Yeah.
If you go and sell it to a person who has zero knowledge about watches, it'll be a liability, because they're not going to end up in a loss. Similarly, in case of dental instruments, when you're going to buy it from someone, if it is maintained properly, then you can immediately find out how much is the cost of a brand new piece of it. Let's say endomotor in this case. Find out the value, how much is it if I take a brand new thing. Then you go to this person who's selling his or her endomotor. Check which brand is it.
Okay.
Check if it has been maintained properly or not. And if you see that, okay, it's in a proper working condition, it has been used properly, it's of single hand used, see how much he or she is quoting for it.
Yeah.
Compare the two prices. And then you will know how much amount of money you're saving. Because that endomotor, tomorrow when you go and if you want to sell it, it's not going to give you the same amount of money. It's going to be less.
Yeah.
Irrespective of how much ever he or she had first invested in.
Yeah.
Same goes with the dental chair. If you're going to buy the best of the best chairs, which has like perfect sensors, everything is touch free, hands free, everything. Yeah. But okay, that value was on day 1. On day 100, the value is going to be much lesser. So please, before buying any dental instrument or any dental equipment, please compare the cost of a new item and the cost if someone's selling it second hand. Please compare the two costs. And when you're comparing, also take into consideration how much time do you want it to stay with you. Also see that how much revenue are you going to generate from it. Since we are talking about the endomotor, you will use it for doing root canals.
Yeah.
When you do root canal treatment, if, for example, I have invested 10 rupees, after how many root canals is that 10 rupees going to come back to me?
Yeah.
And after I have recovered that 10 rupees, how much more root canals can I do with it? Because please, I don't mean to disrespect or demean any brand, but every item, be it electrical or anything, it has its own life.
Shelf life.
Even if it's a material or whatever, it has its shelf life.
Yeah.
After a certain point of time, it's going to give you issues. It's going to give you problems.
True.
You buy something new, you buy something used.
Yeah.
Everything has their own maintenance with it.
True.
So find out the costs of maintenance and check off all of these things. And then you take a decision whether you have to buy something new or if to buy something used. There are a certain list of things which are required. So you have to buy them. The dental chair, your diagnostics, it can be your RVG or your X-ray machines, whatever. All of these things have to be there, but that does not mean that they have to be brand new.
Yeah.
You can very well buy a used setup. It will save you a lot of money. And you have to also understand that after you start working, there is something, this is the administrative part I've been talking about. You have to learn that money management, that capital. So how much ever money you invest in the starting, that's your capital. By saying capital management, I mean how much money are you going to put in for setting your place up? how much money are you keeping aside for the maintenance of it? Because even if you buy something new, within a year, if you don't do servicing at regular intervals of anything that may be, if you don't oil, let's say your air rotors, your hand pieces, why do the shopkeepers say नहीं सर आपको ऑयलिंग करना है, ऑयलिंग करना है? क्यों करना है भाई? ब्रांड न्यू लिया है, मैं नहीं करूँगा. बट वैसा नहीं होता है, ऑयलिंग करना पड़ता है तो ही उसका लाइफ बढ़ेगा. Why are they saying? Because they want their life to increase. So if that air rotor is going to last me for say X amount of years, and I'm going to do those many cavity cuttings or whatever, so I have to also calculate how much money I'm going to make from it. And if I'm going to make a sizable amount of money, then I got to cut the amount I have invested first. Let's say I made 100 rupees, तो 10 rupees तो उसका कॉस्ट प्राइस था, तो वो कट गया, बचा 90 rupees. उसके बाद जो तुमने पेशेंट्स करे, उसका जो इन्वेस्टमेंट टाइम था, उसका भी तो कट करो. तो वो इफेक्टिवली कम होते होते 40 rupees तक आएगा. So तुमने पूरा इसमें खाली 40 rupees बनाया है. Now you think if you're going to buy it at 10 rupees or you want to buy it at 4 rupees, and then you check the ratio, like how much is the cost to your recovery ratio. Because that is when you will, like a lot of dentists, like this is something I've recently post the pandemic, a lot of people I have seen on Facebook and everywhere, they're trying to sell their practices or whatever. They're trying to get away from clinical practices. That's because they're not understanding the factors. It's because they have invested so much, and now because the money is not coming back, they're getting scared. And that is the reason. Because they have not thought about this thing, and I don't feel shy to agree and accept that I had zero idea about all of this. It is only that when I started reading up about this, when I started my clinic, all of these things came to me because I was sitting with the numbers, and I was astonished. I was like, oh my god, and like this is what is the reality. Because from our curriculum involves teaching dentistry, it does not involve teaching administration. That is a totally different ball game.
And you can always buy secondhand, learn it, work with it, and then of course upgrade it to a newer one.
Exactly.
That's
what I'm trying. Like a very good point. Upgrade. When you're practicing on a regular basis, let's say that ratio which I was talking about. If you feel that you have recovered that ratio and that ratio is good, you've got back all the money, then that remnant money which you have earned from it, you can invest that money into a new equipment, because then that will be totally from you're not putting a single penny from your own.
To make more money.
Let that money work for you. Let the money make more money. If you're going to just keep on working for every single penny of it, it's not going to come back. Dentist, for God's sake, dentistry is a business. If you treat it like a business, it's going to give you the returns. If you don't treat it like a business, it's not going to give you returns. If I'm not saying like treat it as a business, please, again, I don't want people to think अच्छा इसको खाली धंधा करना है. नहीं, commercial angle नहीं है. But at the end of the day, you should realize that I mean I don't feel shy about, but भाई अपन तो काम कर रहे हैं क्योंकि मंथ एंड में अपने को पैसा होना बैंक के अंदर. अगर बैंक में इतना पैसा नहीं होना तो घर पे बाप पकड़ चिल्लाएगा. लड़की डेट पे आएगी नहीं, डेट का पैसा अपन भर नहीं पाएंगे, और अपना सब बीच गॉन, गाड़ी का EMI जाएगा नहीं. बराबर. और जो तुमको बाहर मतलब घूमना फिरना है, वेकेशन पे जाना है, कुछ नहीं. तो भाई ये materialistic की बात, like people say, oh, you're too materialistic, you're too money minded. It's survival, man. Like, exactly. I mean, why are we doing this?
Everyone's doing it.
Like everyone is, मुंह पे तो कोई बोलता नहीं, बट आई तो लाइक टू से इट ऑन द फेस. भाई अपने को तो मंथ एंड में पैसा होना, क्योंकि अगर पैसा नहीं होगा तो भाई अपन क्या कर रहे हैं? सर्विस तो अपन कर ही रहे, सर्विस तो करनी ही है. विच इज वाई द वर्किंग इन द DCHC, इन द पैंडेमिक एंड everything is not money, but unfortunately everything that is available is bought with money. It's a very controversial thing, but it's true. I mean,
so like talking about instruments, what's your favorite dental instrument in your clinic?
Now again, I cannot single down one because there are multiple. If you ask me about diagnostics, the Explorer with the shepherd hook.
Anyone.
Dr. Arib, one instrument is not possible. Like there are so many beautiful instruments.
No, just one. I'm sure next time you come, we'll ask you like 5, but today just one.
Okay, if I have to single down, since I am...
I mean, you cannot function without it, or it's something lovely to use it. I mean,
then it has to be the... I think it's not an instrument, but it's a matrix actually.
Okay.
And it's called as a sectional matrix. It's again, this is not paid. There is no sponsorship as of now. You can do it, Dr. Arib. You can contact him anytime for sponsorship. But it's from a company called as Vagotrix. There's a ring, and they give sectional bands. It is a beautiful system.
It comes in 2 sets, right?
Yeah.
Mini and
yes. And there are different sizes to the sectional bands as well.
Because I have the mini one. So
and there's also one from Palodent. It's called Palodent.
Those are legendaries.
So yeah, so these sectional matrix systems. Yeah. So they are not instruments per se, but they help you in restorations. They are matrix systems. They are beautiful. I mean, I swear by them. I don't remember the last time I have taken a TOEFL Meyer. Again, TOEFL Meyer is nice. It has its own applications.
No,
but
you don't need to give like disclaimers, because see, you have to use TOEFL Meyer to reach section.
Exactly.
So everything has its stage. So
but if I'm telling you the
use
day
TOEFL
you start
Meyer in college, don't use sectional in
but yeah, I'm telling you the day you start using these sectional matrices, I mean, and it's not necessarily these brand. You can buy from any brand. It has to just be that system, and you're going to have a ball with it. Because since I'm more into aesthetic and restorative dentistry, I love it. I simply love it.
You also have your own HR consultancy firm.
Yeah,
I wanted to know more about it.
So again, yeah.
Because that's something which I don't think anyone outside your family knows. So
yeah, they don't.
Whatever you could share, please do that.
So yeah, this is back in actually 2018. So my father is into this business. We are basically he runs an HR firm.
Okay.
And we do PF and ESIC consulting. PF stands for Provident Fund, and ESIC stands for Employers State Insurance Corporation. Now these are government bodies.
Yeah.
Now what we essentially do is like let's say if you own a hotel or if you own any corporate company, you want right from your CEO until your janitor maybe, you want certain people to be employed. But you don't have the time to sit and take all those interviews. You don't have the time to sit and make all those government deductions. So you hire a firm. They do all of that for you. They do all of your HR sourcing. They do all of these government deductions and everything. And they will do the salary part of it.
Okay.
And they will charge you a basic professional fee on that. So that is what is my father's base of business. I have been looking at that and I've grown up seeing that. And I always had that thing in my mind like, you know what, oh, this is also nice. But it's just that I never had,
inclination to
it. I was not much inclined towards it. But it was only later, like after I finished my dentistry, I was like, okay, I'm going to do something else as well. Because that, like me being me, I've always had that kid of doing something or the other. Ek aur yaar ye bhi karta hai, wo bhi karta hai. So I was like, why not do this? And because I won't say I had the book theory knowledge, but I had the practical of it. And I was like, it's just there. And I've been doing it. I used to help my father also at times. So like, why not make one for myself? So I established that. 2018 was when I started getting all these thoughts. 2019 Jan was when officially I registered the firm. It's a proprietorship firm. And since then it's just been great because whenever I get time, I do that. And I've set it up in such a manner now it's on an autopilot mode. So I need not be there every day. I just spend, if you ask me how much time I'm giving to it, apart from dentistry, 1 or 2 days at the max in the week when those 2 days I am completely in the office and I do all of that work. The rest 4 days I am only into dentistry. But yes, it's a beautiful thing to do because it just gives me a sense of it's that independence and it's that plan B. Like sometime back I spoke about plan A, plan B, plan C. It's just that. Like plan A is of course dentistry. Plan B was this. Not that I'm not happy with dentistry, but it's just that always better to have an additional source. And if it's something which you know about, all the more easier. Like Dr. Arib right here, he also is a dentist, but we obviously, like, all of us listen to him on this podcast. So like these are different things, but like you should have that passion for it. You should love it. And if you have the interest in it, why not do it?
Yeah.
Because no matter what, if you've put in any amount of work, any amount of effort, it'll never go waste.
Yeah,
it will definitely bring you something. So need not be like, okay, it's only got you financial gains or whatever. It can even give you some other recognition which you might not know might be happening. It might be in the pipeline. Like tomorrow we might not know Dr. Arib might just feature on some TV show and all of us are going to be like, I was there on a podcast.
And the favorite episode was with Dr. Devang. No, so but then why didn't feel the need to do this too? I mean, I understand like you had this is more like a plan B.
Yeah.
But is there any more reason?
Again,
are there more reasons for that?
Yeah. Now again, this might sound again very commercial or what, but like just like everybody, I also had some things in my mind, and for those things, I was like, I need to have an additional source of income, and if I have to kind of reach there, I think I need to whatever efforts I'm taking, I need to kind of increase them.
Yeah,
and not like I'm not giving my efforts to dentistry, but it was I just spoke about it to my parents, and then they had a very open thing. The only thing my father said was, "You do it if you want to do it. There is no force."
Yeah,
and that does not mean that you stop doing dentistry. I said, no, that's never going to happen. And then he asked me, why do you want to do the same question? He said, why? Because you have a clinic, why you want to do this now?
Yeah.
All of a sudden, why now? Because I still remember when, after 10th, when they asked me, science or commerce, I had very clearly said, it has to be science. I'm not going to take commerce. And now when I was doing this, my father was like, that time you said no to commerce, but now you want to start this company. So, I'm not understanding. So it was difficult. But yeah, then the sole reason was I said that just doing one thing in today's day and age is, I'm not saying will not suffice. But for me, I think I have set some goals for myself. I've set some targets for myself.
Okay.
And for achieving those, I required to do something other than dentistry.
Fair enough.
And apart from that, also because now since my father, of course, he'll never say it on my face, but it's something he's built from scratch.
Yeah.
So if I'm going to start a company on those lines, maybe Papa future mein aapki company mujhe de doge. But yeah, anyways, but I also there was a little emotional aspect as well. I wanted him to feel a little happy as well, because he'd always push me towards business, and he'd always push me towards commerce. But I, being myself, I never gave him that.
Now you're doing
importance.
both. Both.
Yeah. So again, the emotional tangent was that I wanted to see them happy. I wanted them to know that when I did my thing. I put my foot on कि मुझे science ही करना है, मुझे doctor ही बनना है. Did that.
Yeah.
But at the same time, I also wanted to respect their things, because they will never see it. They will never force it to me. But I can understand that they also kind of expect it from me, that I should be doing something.
Understood.
And which is I said, okay, if this is what is going to get me there, and if they are going to be happy, even 1% from it, I think it works. And even irrespective, if I don't reach those targets, I think he's going to be smiling, saying, "Chal, tune try to kar liya," and that is enough for me.
And the fact that you're trying, means it's people are scared to do the first step.
Yeah.
Trust me, when you do the first step, everything, like you said, the famous Shah Rukh Khan quote.
Please, we are Bollywood buffs.
So last thing before for this podcast is, what's next for Dr. Devang in 2022 and beyond also, but immediate plans.
Immediate plans are after, I want to pursue another fellowship course.
Okay.
And that would either be with lasers, or it would be with the magnification, that is microscopes, because that is what I intend to add onto my practice next.
Yeah, lovely.
Because I think dentistry per se is becoming digital, and I think it's becoming more of it's like patients also have given that feedback wherein they want less of the less of cavity cuttings and all that with the air rotors, because that is
minimal invasive.
Very nicely said. Minimal invasive dentistry is the thing of today. So whatever we can do to make dentistry as minimally invasive as possible, I think we should incorporate that into our practices. So if you ask me what's next, it's definitely the microscope, because for better magnification, better vision.
That's the dental part.
That's
any other things you would like to share with us?
Other things,
or give a sneak peek.
It's not exactly dentistry, but it is kind of related to dentistry. But in the next, I can't say 1 year, but definitely in the next 2 years, I will be sharing it with everybody. And
that's too long.
Yeah, because
it's too long, 2 years.
Yeah, it's kind of long, because So I can tell you one thing, the sneak peek, since you asked, it's into the R&D stage.
Okay.
I'm not really, I cannot reveal the details, but definitely it's not something totally out from dentistry. It's kind of related to it. But again, it's since it's in the R&D stage. But again, even if that doesn't, so that's my plan A.
Yeah.
If that doesn't go through, plan B involves something which is directly related to dentistry, but that I can say it's a part of the supply chain. For now, I can just say that. So that is what is next.
I can understand a bit of it, but it sounds exciting. Exciting.
It's trust me, if it works out, and this one thing I can say on the podcast, if it works out, I will rope in first of all of my colleagues, whoever I know, I will try my level best to rope them in it. And of course, it's on them whether to take it up or not.
Understood.
But I will the moment I can see that okay, it's working out, I will immediately get out with it, and I want more dentists to come into it because it's a great thing, and I think it will address a major issue for a lot of clinicians in particular, because this is something they find every time with their materials, with their okay, no more details, but
I think
it's going to help all of us.
A lot of people are going to be behind you, like to ask you what is it.
I will, but again, like just keep that, like थोड़ा अब कर रहे हैं अपन उसके लिए काम, शिद्दत भी दे रहे हैं.
So I mean, that I mean you there's nothing better than that. And it brings a smile to your face. Just thinking about it.
Dr. Arib, I'm telling you, like, just since you asked me right now, like, I'm just kind of imagining it. If it's, I'm imagining myself talking about it on your podcast once it's totally out, and I'm like, oh my God, we spoke about this, and it's happening now.
See, there was a day where I thought about doing podcasts.
Exactly.
And it's happening.
Yeah.
So same with you. You are thinking about it. It's already in your head.
And it's beautiful. And one thing, I think the take home thing from this podcast, everybody, dentistry is beautiful. Mm-hmm. Dentistry is absolutely a work of art. Only and only if you love it. Mm. And only if you have the passion and a drive for it. Mm. Do not say that, dentistry is not that paying, or it's not that great. It's very saturated, or whatever. Saturation is there in every field, in every aspect of life. That does not mean people stop doing it. Come on. If you love something, you're going to make it through. Like, let's just take the best example of these. Nowadays there are EVs coming in. Okay.
Yeah.
Now, as a car enthusiast, I love ICE, like internal combustion engines, ICEs. But EVs, I had the opportunity to drive one EV, and that got me. I'm like, oh my God, like this is something absolutely different. But again, I would still root for an ICE powered vehicle, but that does not mean people aren't buying EVs. Yeah. People are still buying it. So you cannot say कि नहीं यार इसका future नहीं यार अभी इसका इतना demand नहीं. If you have belief in something, whatever you're creating, whatever you're making, that will create its own niche. You will not need to worry about it.
Yeah.
It has to be your own thing. It has to be your original thing, and it has to be your effort. That is all that matters. And you have to be happy. If you're not happy doing it, please don't do it. Be it life, be it dentistry, be it relationships, whatever. If you're not happy, don't. Get out. In short.
I can't say anything beyond that. So thank you, Dr. Devang, for this lovely episode. Thank you for taking out time from your very busy schedule. We'll hopefully catch you again in the following seasons.
Definitely. I am looking forward to every podcast, and I am myself extremely thankful and grateful that you've given me the opportunity to come and speak over here. Because, and again, like to everybody, let me just tell everybody, Dr. Arib is 3-4 batches senior to me, but never have I felt that gap between us. I mean, it's so easy to converse with him. It's so easy to just talk to him. I don't think very few people I have met who have been able to converse that easy. And touch wood, again, I would like to say, like, it's the universe manifests it. Like, when you're heading towards a thing with your intention has to be clear. You will get the right people on the way. If you believe in something, things will fall in place. You will meet the right people.
And we connected after so long.
Exactly. Like this has been, oh my God.
Yeah.
It's been after a very long time. Yeah.
So thank you again. We'll hopefully see you soon. Thank you so much.
Definitely.
Thank you.
Cheers.
Done.
Pura record ho gaya?
See, could have gone more, but then
time constraint.
Yeah. No, like people have to be like, next time. So